Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966.
Good morning and welcome to Radio Friends on Monday, September the 25th. A pleasure to have you with us. And I've got two of my friends. Both of them are dentists, Dr. Philip Batson and Dr. Elizabeth Abe. Good to have both of you here.
Thanks for having
us. From Columbia Healthy Smiles. And you know, we're now in the back to school mode. And kids are playing sports in grade school and high school and college. And I guess this is a time of the year, too, when you start to see some dental injuries, right, with sports. What's the most common injury that you see when it comes to kids and playing sports?
Usually, it can depend on the sport they're playing, but, usually it's either a chipped tooth, I'd say is kind of the most common that we see, where they chip an edge of usually a front tooth that gets knocked or hit, and they maybe lose a piece of that tooth, or and depends on how the type of trauma that's taken is of how much of a piece of the tooth could be missing.
Okay, let's say if it's a chipped tooth, what do? Do they try to save that tooth? Many times that chip is gone, right?
Yeah, if you can't find the chip, which is not uncommon depending on the size of it, it really depends on how significant the chip is. Depends on is the patient having pain or no pain? Is it a chip or break enough that has exposed the nerve of the tooth? That would usually be accompanied with some pain. And so if you kind of depending on that, sometimes the tooth can be kind of rebuilt with our filling materials or crown materials, but sometimes if a nerve is involved, it could need some nerve treatment as well, which could be potentially like a root canal or something like that, if there's nerve damage.
Let's say if it's one of the front teeth, and it's just broken right in half.
Okay,
right in half. Is there enough tooth there that it can be rebuilt without having to do a root canal, or is it something that is an extensive bit of restoration?
Well, it kind of depends on the age of the patient, too. When you're younger, the nerves within the tooth are a little bit larger, so you can expose that nerve a lot easier than like an older, more developed.
So if it's one of your front teeth, and let's say it's broken off right in half, you're saying the nerve could be that far down in the tooth?
Yeah, the nerve could be exposed, and what you would see is like a red color or like blood coming from the tooth.
And that would be hurting? It
would hurt, yes.
What do you do there?
You would want to contact your dentist.
Right, but I mean, is that something then that would the tooth have to be taken out, or can it be repaired?
It can usually be repaired, as long as there's, basically we kind of judge it on how far it fractures to bone level, and usually those injuries are above the bone or above the gum, and so they can typically be saved with a root canal or some sort of treatment.
Okay. Let's say if you're playing football or some contact sports like that, you get hit in the mouth and you knock a tooth loose, but it doesn't fall out, but you can feel it wiggling around in the mouth. Mm-hmm. What happens there?
Again, definitely contact your dentist. And again, it kind of depends on the situation. So sometimes these teeth, even if they're loose, if they don't fully come out, the tooth can be repositioned into the correct position, and then sometimes it can be splinted into place. So we can put a splint that kind of connects the tooth to the other teeth, and so that it stabilizes it, and then we monitor it and let it heal. And
the muscle will grow back, or the gum will grow back around it?
The gum and ligaments around the tooth can heal, and it can re-solidify in its socket and its spot. As long as there's no like breaking of the jawbone around the tooth or anything like that. It's all just a slow healing process sometimes. And even after it heals and if it restabilizes, it could still need some nerve treatment or therapy, like a root canal, because most like on a knock like that, the nerve could have gotten damaged. But if there's a potential to save a tooth, it can be restabilized.
Okay, so if you got a loose tooth in your mouth, it jiggling around, just go to the dentist right away and see if they can't take care of stabilizing it there.
Sometimes that's the case. Sometimes it might be too far gone. The tooth might have to be taken out. The situations really can vary.
Yeah. You mentioned, when we were talking about the topic here, you mentioned mouth guards. Mm-hmm. Oh, how important are those mouth guards?
Very, I think, especially if you're going to be doing any sort of contact sport, anything where there could be facial trauma, potential for it, whether, I know people think of football a lot. Luckily, there are helmets in that, but they take lots of hits. But, anything where you could catch an elbow or a foot or, a bat or a racket or anything that could potentially cause some trauma. A mouth guard is very, very important. It's an ounce of prevention to really negate some really significant treatment in case of a knock.
Mm-hmm. In the younger kids who are just starting in school and just starting in sports, what's a common injury that you see or you tell parents to watch out for?
It's always usually the front teeth. You typically get those teeth around 8-9 years old, and that's also usually when trauma and physical activity starts to happen. And even the smallest trauma can sometimes cause like lifelong issues down the road. So that's just something to keep in mind. And so going back to a night, or not a night guard, but just a guard in general, it's an easy way to prevent something like that from happening.
At 8 or 9 years old, do you have all of your permanent teeth in?
Not yet. But usually the two front teeth start to come in around that time.
And those are permanent teeth?
Yes, or they're still developing.
What happens if you knock out one of the baby teeth? Do you worry too much about that? You just let it go?
Typically not, yeah. We just kind of make sure that there's still no remaining root structure left there, but we wouldn't put it back in or anything like that.
All right. If people have any questions about this, they can contact you. But the important thing, if the kids haven't been to the dentist yet and they're youngsters, you really need to get them in for that first visit, right?
Yeah, just to take a look around and check the overall health, check the development, and like you said, if there's questions about activities, and definitely take that up with your dentist. Ask them about if they think a mouth guard's a good preventative option.
Got it. All right. For more information, you can give them a call at Columbia Healthy Smiles, and your phone number is
573-875-7071.
If you're worried about pain, don't worry about pain. They'll make sure that you don't have any pain at all. Dentistry has changed a great deal from when I was a young kid, but I know that firsthand. Have yourself a nice day. Bye-bye.